Hey, it's Dr. Birchler. What I'm going to go over with you today is a spinal pain syndrome pattern that can happen following epidural injections, typically during labor and delivery for women. And an epidural is obviously an injection into the spinal area to try to minimize pain. And the injection is commonly done into the mid or upper lumbar spine, below where the spinal cord ends. And the purpose is to put chemicals around the cauda equina nerves that are coming off the spinal cord to try to create an anesthetic effect. However, in order to do that injection, the needle has to puncture through skin, through fascia tissue, through ligaments, and finally into the spinal canal. So there is tissue that is punctured or injured to get that epidural in there. So even without nerve damage or something bad happening, just that puncture in through the tissue at that level of the spine creates a spinal pain syndrome in many women. My experience in pointing this out to women is they've never been told or shown that they're having a problem from the epidural injection or a pain syndrome that is coming from that region of the spine, but it's commonly the L2, what's called the sclerotome region of the body associated with the L2 nerve or sclerotome where the pain is. And let's see if we can get a picture of that up here. So this is called a sclerotome chart, and it looks a little bit confusing here, but let's zoom in a little bit. So if you look at someone's back, the L2 vertebrae is right around here, and the epidural is done commonly in this region of the spine. Now, down the road, a woman may have pain that they feel like is in their hip or their back, commonly in the region of this dark light blue area, and they'll feel like it goes into their hip, so it kind of emanates out into their hip or buttock area, so they'll call it like their hip. And then it can wrap to the front, so in this we see this L2 is this light blue, and it may come around the front of the hip. It may go right into the groin, like deep in the, feels like almost in the hip socket, but deep into the groin. And it may also kind of radiate down the kind of outside and or front of the thigh towards the knee, and it might hurt quite a bit into the thigh area or above the knee. So when someone has had this particular pattern, that they have pain in the groin, they have pain going down into the thigh, they have pain in the hip, back, or buttock area, and it's this classic L2 pattern, I'll commonly ask them, hey, did you have an epidural with the pregnancy? And the answer is often yes. And when we then make adjustments in that region of the spine, in that L1 to L2 area, it is oftentimes dramatically relieving and able to resolve that pain, assuming there's not actual nerve damage from something from the epidural. So if you're a gal out there who may have a similar kind of thing, pain in the hip, buttock, in your groin, going down into your leg, thigh, knee area. Some people may think that there's something wrong with their hip. They may think there's something wrong with their knee. They may think there's something wrong with their pelvis, but it's actually a spinal pain syndrome associated with the epidural in this case. You probably get wonderful results from chiropractic. And if you have any questions about this or comments, certainly let us know, but we'll do anything we can to help you.